When is it time for Sjögren's testing, or when is the right moment to actually pursue it? If you have dry eyes but just rely on artificial tears, but the fatigue never lifts, and your mouth feels like sandpaper no matter how much water you drink, Sjögren's disease may be affecting you more than you realize. Most people think an autoimmune diagnosis only matters once things become serious. But Sjögren's doesn't always announce itself with a dramatic moment, and neither should your understanding of when testing actually make sense. In this video, I'm going to explain what specialists really look for when evaluating Sjögren's disease, what symptoms matter most, what doctors actually look for, and how to know whether it's time to have a conversation, or whether waiting is completely reasonable. Because here is the part that surprises most people. Sjögren's is not rare. It is not unusual. It is one of the most common autoimmune diseases in the world. And yet most people sitting with these symptoms right now have never once heard its name mentioned by a doctor. That is what this video is about. Not just the symptoms, but the pattern, the story, and what to do when you finally recognize it. Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Insight is 200,000 subscribers, and every single person who joins moves us closer. And if that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send you the link to access it directly. One of the biggest misconceptions about Sjögren's is this: if my eyes are just a little dry, it can't be that serious. But dryness is only one piece of the picture. What many people don't realize is that Sjögren's is a systemic autoimmune disease, meaning it doesn't just affect one area. It can involve the joints, the nerves, the kidneys, the lungs, and even the skin. Many people still pass a basic checkup but quietly struggle in daily life. Sjögren's affects how you function, not just what a lab result says. And because it progresses so slowly over time, many people don't even realize how much their life has changed around it. Think about that for a moment. The condition doesn't arrive suddenly. It creeps in slowly. A little more tired than usual. Eyes that need drops more often. A mouth that feels unusually dry in the afternoon. Small things, individually, that seem easy to explain away. That's exactly what makes Sjögren's so easy to miss. Each symptom, on its own, points somewhere else. The eye doctor adjusts the prescription. The dentist recommends better hydration. The primary care physician orders thyroid labs that come back normal. And the patient walks away without an answer, again. Researchers have observed that the average person with Sjögren's sees multiple specialists before anyone connects the dots. That is not a failure of the patient. That is a failure of awareness. And understanding that distinction matters, because it changes how you advocate for yourself. One of the most common things I hear from people who are eventually diagnosed with Sjögren's is that getting through normal days feels exhausting and uncomfortable. Energy disappears without warning. Everything feels harder to get through. Many patients say, "I look fine, but I just don't have the energy I used to." Or, "I stopped making plans in the evenings." What's happening is that instead of recognizing a medical symptom, people quietly adjust their life around the limitation. Others stop activities they used to love altogether. It's about independence, energy, and confidence. And those things are closely tied to overall quality of life. Here is where things become important to understand. The fatigue associated with Sjögren's is not ordinary tiredness. It is not fixed by a good night of sleep. It is not explained by doing too much. It is a deep, persistent, cellular-level exhaustion driven by chronic immune system activity happening inside the body around the clock. And here is what makes it so frustrating for so many people. This kind of fatigue will not show up on a standard blood panel. It won't appear on a thyroid screen. It won't register on a complete blood count. Doctors often see patients who have been told everything looks normal for years, while the underlying inflammation continues quietly. Many people eventually stop making evening plans. They start scheduling their days around needing to rest. They cancel things last minute, not because they don't want to go, but because their body simply won't cooperate. This may seem like aging. It may seem like stress. But over time, these adjustments are your body's way of signaling that something deeper is happening. And here is the part that catches many people off guard. The longer that signal goes unrecognized, the more the body reorganizes itself around limitation rather than health. People stop expecting to feel good. They start accepting a lower baseline as normal. And that quiet acceptance is one of the main reasons Sjögren's continues to go undiagnosed for years at a time. If any of this sounds familiar, pay close attention to what comes next. Another very common thing I hear from people with Sjögren's is this: my eyes keep getting worse even though I'm using drops every day. In reality, the drops are often used correctly. But Sjögren's changes how the immune system interacts with the moisture-producing glands. The natural tear and saliva glands become targets of the body's own defenses. In simple terms, the immune system, which is supposed to protect you, begins attacking the very glands that produce tears and saliva. Over time, those glands produce less and less. The damage is gradual. But it accumulates. Even the best artificial tears can't fully restore what those glands are supposed to do. So each new bottle of drops helps a little less than the last. For someone who has relied on eye drops for years, increasing dryness is a reasonable next concern. But when that still doesn't help, it's important to have a conversation and a complete evaluation with a specialist to determine whether Sjögren's or another autoimmune condition is responsible. And it's not just the eyes. The dry mouth that comes with Sjögren's is equally misunderstood. Many people assume dry mouth is a side effect of medication, or simply a consequence of not drinking enough water. And sometimes that's true. But when dry mouth is driven by Sjögren's, the salivary glands themselves are being damaged. Saliva is not just water. It contains proteins and enzymes that protect the teeth and the lining of the mouth. When those glands stop functioning properly, the consequences show up in unexpected places. Dental cavities appearing faster than ever before, despite good hygiene. Difficulty swallowing dry foods. A burning sensation on the tongue. Mouth infections that keep returning. Many people spend years in the dental chair being told to hydrate more, when the real answer is that their immune system is attacking their salivary glands. That's not a dental problem. That's a systemic disease presenting in the mouth. Sjögren's, when unrecognized, can create real safety and independence problems. This is where it moves beyond inconvenience. Chronic dryness can lead to corneal damage and significant dental erosion, even in people with excellent hygiene. Fatigue and joint pain can affect balance, make it harder to stay active, and quietly reduce the ability to function normally. When is waiting for Sjögren's testing actually counterproductive? Testing is usually not urgent. But allowing symptoms to continue without a name means the underlying inflammation keeps progressing. Researchers have found that Sjögren's is also associated with a higher risk of non-Hodgkin lymphoma over time, making early diagnosis important for monitoring. The key is balance. Not rushing, but not ignoring meaningful symptoms either. Let's talk about what unmanaged Sjögren's can look like over time. Because this is the part that most health content skips over. When the cornea is repeatedly exposed to insufficient tear film, microscopic damage accumulates on the surface of the eye. At first, it feels like irritation. Then it becomes sensitivity to light. Then, in some cases, it progresses to corneal scarring that affects vision in ways that drops alone cannot reverse. When the joints are involved, which happens in a significant portion of Sjögren's cases, persistent inflammation can lead to stiffness, swelling, and reduced range of motion over time. This is not the same as rheumatoid arthritis, but it shares enough overlap that the two conditions are frequently confused. When the peripheral nerves are affected, a less well-known but real manifestation, people may notice tingling or numbness in the hands and feet, difficulty with balance, or a strange burning sensation that travels along the limbs. This is called peripheral neuropathy. And in the context of Sjögren's, it often goes unrecognized for years because no one is looking for an autoimmune connection. When the kidneys become involved, it is usually silent until a routine lab shows abnormalities in kidney function. This is one of the reasons regular monitoring matters once a diagnosis is established. And then there is the lymphoma connection, which catches many people completely off guard. People with Sjögren's have a measurably higher risk of developing non-Hodgkin lymphoma compared to the general population. This is believed to be related to the chronic stimulation of the immune system over time. The absolute risk remains relatively low, but it is real, it is documented, and it is one of the strongest arguments for early diagnosis and ongoing specialist follow-up. The good news is that with awareness and monitoring, these risks can be tracked and managed. The problem is that you cannot monitor a condition you haven't diagnosed yet. Here's something doctors rarely explain clearly. The average time from first symptoms to a confirmed Sjögren's diagnosis is currently around 3 years. 3 years of dry eyes being dismissed as allergies. 3 years of fatigue being attributed to stress. 3 years of dental problems with no clear cause. What many people don't realize is that an estimated 2.5 million Americans are living with Sjögren's right now without knowing it. It is the second most common autoimmune rheumatic disease, 3 times more prevalent than lupus or multiple sclerosis. And 90% of those diagnosed are women. Pay close attention to that. Because Sjögren's is common, it is underdiagnosed, and the people most affected are often the least likely to have it recognized quickly. Why does this happen? Part of the answer is symptom overlap. Fatigue is one of the most common complaints in all of medicine. Dry eyes affect millions of people for reasons that have nothing to do with autoimmune disease. Joint pain is attributed to aging. And dry mouth is dismissed as dehydration or medication side effects. Each symptom individually has a simpler explanation. It is only when you look at the pattern, the combination of symptoms, the timeline, the way they interact, that the picture becomes clear. The other part of the answer is awareness. Sjögren's is not discussed the way other autoimmune diseases are. It doesn't receive the same cultural recognition as lupus or rheumatoid arthritis. Many primary care physicians will not bring it up on their own. Many patients have never heard of it at all before arriving at a rheumatologist's office years into their symptoms. This is why understanding the pattern matters more than any single symptom. And it's why knowing what to ask, and who to ask, can genuinely change the timeline of diagnosis. So what does a proper evaluation actually look like? Specialists look at the complete clinical picture. Specifically for Sjögren's, they assess whether a pattern of symptoms, dry eyes, dry mouth, fatigue, joint pain, is supported by laboratory findings. Blood tests check for specific antibodies, particularly anti-Rho, also called SSA, and anti-La, also called SSB. These are among the most important markers. Antinuclear antibodies and rheumatoid factor may also be elevated. A simple eye test called the Sjögren's test measures how well the tear glands produce fluid. Ocular surface staining can reveal damage you may not yet feel. Saliva production can be measured through a painless test. And when antibody results are unclear, a minor salivary gland biopsy, a small procedure on the inside of the lower lip, can confirm the diagnosis by revealing the characteristic immune cell pattern. A complete evaluation also looks for other explanations. Lupus, rheumatoid arthritis, thyroid disease, and hepatitis C can all cause overlapping symptoms. The goal is to find the true source. Let's walk through what each part of this evaluation actually involves, because understanding the process makes it far less intimidating. The blood test for anti-Rho and anti-La antibodies is a standard draw. It's the same kind of blood test you've likely had before. A positive result strongly supports a Sjögren's diagnosis, but it's important to know that not everyone with Sjögren's will test positive for these antibodies. Some estimates suggest that around 30% of people with confirmed Sjögren's are seronegative, meaning their antibody results come back negative even though the disease is present. This is one reason why the evaluation doesn't stop at a single blood test. The Sjögren's test is something many people have never heard of but is completely painless. A small strip of filter paper is placed gently under the lower eyelid for 5 minutes. The amount of moisture absorbed by the paper gives the specialist an objective measurement of tear production. Low results support a Sjögren's diagnosis and help guide treatment for the eyes. Ocular surface staining uses special dye drops to reveal microscopic damage on the surface of the eye that would otherwise be invisible. Under a specialized lamp, the specialist can see exactly where and how much the dry eye has affected the cornea. This information matters both for diagnosis and for understanding how urgently the eyes need protection. The salivary gland biopsy sounds more intimidating than it is. It involves a small incision on the inside of the lower lip, through which several tiny salivary glands are removed and examined under a microscope. The procedure is done under local anesthetic. What pathologists look for is a specific pattern of immune cell clusters called focal lymphocytic sialadenitis. When this pattern is present, it is considered one of the most reliable confirmations of Sjögren's disease available. Imaging of the salivary glands, using ultrasound in particular, is increasingly being used as a non-invasive way to assess gland structure and damage. Research suggests that salivary gland ultrasound may eventually become a standard part of the diagnostic workup, offering additional information without the need for biopsy in many cases. The point is this: a proper evaluation is thorough. It is multi-layered. And it requires a specialist, typically a rheumatologist, sometimes working in collaboration with an ophthalmologist and a dentist, who is looking at the whole picture rather than a single symptom in isolation. At the same time, Sjögren's evaluation is a shared decision between you and your physician. We consider how symptoms affect daily living, safety concerns, overall health, and most importantly, your goals. No one should feel rushed into testing. And no one should feel dismissed when their symptoms are real. The most important thing to remember is this: Sjögren's testing isn't about a number on a lab report. It's about how your symptoms affect your comfort, your confidence, and your safety. If dryness, fatigue, or unexplained pain are limiting what you do, it's worth having a thoughtful conversation with your doctor. And if your symptoms are mild, waiting can be completely reasonable. But here is what understanding Sjögren's early actually gives you. It gives you a name. And a name changes everything. A name means you stop being a mystery. It means your symptoms are no longer dismissed as stress or aging or something you just need to live with. It means there are specialists who understand exactly what is happening in your body. It means treatments, some simple, some more targeted, become available to you. It means the fatigue you have been quietly managing for years finally has a context. The dry eyes that never quite responded to drops have an explanation. The dental visits that kept ending in confusion start to make sense. And perhaps most importantly, it means you can stop blaming yourself. Because one of the most quietly painful parts of living with an undiagnosed condition is the feeling that something must be wrong with you. Your habits, your stress levels, your willpower. A diagnosis removes that burden. It replaces it with information. And information is where recovery begins. There is also a community side to this that is worth mentioning. The Sjögren's Foundation in the United States supports patients, funds research, and provides resources for people navigating this diagnosis. Connecting with others who understand the pattern of this disease, the fatigue, the dryness, the long road to diagnosis, can be genuinely meaningful for people who have spent years feeling like no one quite understood what they were describing. So what should you actually do if any of this resonated with you? The first step is to write down your symptoms. Not just the dry eyes. Everything. The fatigue. The joint stiffness. The dental changes. The difficulty swallowing. The brain fog, if that's present. The timeline of when things started. The pattern of good days and bad days. Bring that list to your doctor and ask specifically, could this be Sjögren's? Ask for a referral to a rheumatologist. Ask whether blood tests for anti-Ro and anti-La antibodies have ever been ordered for you. If they haven't, ask why not. You are not asking for too much. You are asking for a diagnosis. And you deserve one. If your symptoms are mild right now, if you read this and recognized yourself but feel like things are manageable, that's okay. Waiting is sometimes the right answer. But staying informed, continuing to monitor your symptoms, and having the conversation early puts you in a far better position than discovering the diagnosis years down the road when more damage has accumulated. The goal is not fear. The goal is clarity. Knowing what is happening in your body, even if the answer is uncertain for now, is always better than not knowing. However, if you'd like to understand why Sjögren's is one of the most underdiagnosed conditions in the country, and what makes it so easy to confuse with something else, watch our next video on the diagnostic gap in autoimmune disease. As always, feel free to leave questions and comments. Please like and subscribe for more content like this. Thank you for watching.